everyone, and welcome back to another insightful episode of MedSynapse podcast series, where we bring you experts' insights from leading healthcare professionals across the globe. I'm your host, Hetvi Shah, and today we'll be diving into a transformative area of neurosurgery, which is endoscopic spine surgery, with a focus on how patient selection impacts outcomes. With the growing demand for minimally invasive approaches, understanding the right candidates and expected results become crucial for advancing patient care. And joining me is Dr. Teak Sheng, a highly accomplished consultant neurosurgeon and minimally invasive spine surgeon based at Penang Hospital in Penang in Malaysia. With over 2 decades of experience, Dr. Gee is a pioneer in advanced unilateral biportal endoscopy for spinal conditions and also manages a wide range of complex neurosurgical cases, from brain tumors to neurotrauma. His expertise truly bridges the worlds of spine and brain surgery. So, Doctor, we are so delighted to have you today and welcome to the show.
Yeah, thank you, Heavy. I'm so glad that you invited. I'm so glad that we can meet today and talk about this topic of endoscopy spine surgery.
Yes, Doctor, I'm excited to hear your insights as well. So, Doctor, to start with, over the last decade, how has the role of endoscopic techniques in spine surgery evolved and what factors have driven their adoption?
So when I first encountered this endoscopic spine surgery, often my colleague think that this is a very niche technique, and mainly this is for only soft disc herniation. That was 10 years ago. So over the last 10 years, the role of endoscopic spine surgery has expanded, mainly because there's improved in the optics, the scopes, the improvement in the instrument, as well as more surgeon training is available. So now in Penang, we are very confident in addressing situations like lumbar stenosis, spinal stenosis, even revision cases, and also certain cervical and thoracic pathologies. And lately, we even have done intraspinal extradural tumor as well. So the key shift for the last 10 years have moved from simply can we do it endoscopically to should we do it? So it means that patient benefits have become the main focus in adopting this kind of surgery. And today, patients also expectation is very high. They expect have a faster recovery, they expect lesser pain, they expect earlier return to functions and minimal downtime. So with this kind of expectation, endoscopy seems to be able to align perfectly with these goals, and no longer big spine surgery is peripheral, but it is increasingly become mainstream in spine surgery in Malaysia, Penang, and I believe that it will be mainstream around the world as well.
Yes, I think that's a great overview, Doctor. And I think it's like clear that what you call both technological innovations and patient expectations have actually played big roles in shaping this field.
Yes, exactly.
So now, Doctor, patient selection is often the key determinant of success in endoscopic spine surgery. So, what clinical and radiological criteria guide your decision makes?
Yeah, so the success of the surgery also rely much on patient selection, and patient selections come from we carefully pick those who are suitable for this surgery. So it is absolutely crucial. So clinically, you look for patients that have radiculopathy, either one leg or both legs due to this herniation, or in lumbar stenosis, often patients have neurogenic claudications. They'll tell you that they have difficulty in walking. As they walk further, they feel very bad, leg cramps, and some they have even urinary incontinence. So when they have these symptoms, they are very good candidates for endoscopic spine surgery, especially if all conservative treatments have failed, then you know that they will benefit from endoscopic surgery. Radiologically, you must have clear correlations. Means that you look at the scans, it must correlate to the symptoms, neurologically as well. So the single level Ds compressing one nerve root, it should, give rise to single root symptoms. But focal stenosis, it will match to the patient's symptoms as well. So on the other hand, I will avoid patients that have very gross instability. If patient have severe infections of the operative level or have advanced deformity, those patients I would have different strategy for them and not for endoscopic surgery. So in short, the right patient for the right procedure, that will make the outcome very much predictable, that will make the surgery safe, and that will make the patient benefits from endoscopic surgery.
Yeah, I think that actually makes perfect sense. Choosing the right patients actually seem to be just as important as the surgical technique itself, then I would say. So now, doctor, from a neurosurgeon's perspective, what are the major technical and patient-centered advantages of endoscopic spine surgery compared to those of traditional approaches?
Yeah, compared to traditional approach, which either you do as an open or microscopic surgery, from endoscopic perspective, you can see that the first advantage is very clear vision and also precision. Endoscopy able to give us magnified and high definition visualization. So you can do very targeted decompression with minimal collateral damage to the skin, to the muscles, and even the bone. So the second advantage will be it is very much muscles and soft tissue sparing. So this would translate into very fast recovery, minimal pain. You do not need much of analgesia after surgery, and often the hospital stay are short. These are the outcomes that matter a lot to the patients, and you can see that once you adopted this kind of minimal invasive technique, a lot of patients will have a good word of mouth of what you have done to them, and they appreciate what you have done to them. So third, this technique of UBE, unilateral biportal endoscopy, also allow us to handle central and foraminal and lateral recess stenosis in one sitting. Okay, and because of it able to be done in one sitting, you do not need a very large incision to achieve those kind of surgical objective. So overall, it combines safety, it combines effectiveness of decompression with a lot of minimal invasive spine surgery benefits as well.
Yeah, I think the combination, as you mentioned, of precision, time saving, and also less operative pain can make a huge difference, I would say. So now, doctor,
Yes.
my favorite question out of all is like, could you share some real world examples where, careful patient selection translated into better outcomes for your patient?
Yeah, so it's very important to share also what are the real world cases that I have encountered. Often I remember the case is elderly man, 70 plus years old, who have diabetes, high blood pressure, and also ischemic heart disease. And this patient have a bypass as well. So he is on antiplatelet. So you can imagine that this patient with a very bad spinal stenosis and he needs surgery. So thinking of his problem, if you were to do an open surgery, you will have higher risk of blood loss, you will have higher risk of recovery, So after discussing, we decided to go ahead with endoscopy, and for a short while, we have to stop the antiplatelet as well. So the decompression done endoscopically can be, it was perfect. And he was able to walk the next day after X-ray, confirmed that there is no spinal instability. And about 48 hours after the surgery, he's able to go home. And this kind of case convinced us we should continue using minimal invasive even for high-risk patients. And the benefit of minimal invasive patients' surgery is even more obvious. So another case is I have a young patient who worked as a chef, and because the floor was wet and she fell down, and there's a large disc herniation, and she also has cauda equina syndrome, and it had to be done as an emergency at night. And when we did the surgery at night, took out the disc and repeat the MRI, it was fully decompressed, and she could walk back, And just after about a day or two, she could return home, and after about 4 or 5 weeks, patient could have returned back to work on light duty. So if I were to compare this kind of emergency case done conventional, it would take longer period of recovery, maybe up to a few months or a few weeks more than if we done minimal invasive. So in real world cases, these are very good success story that should inspire many of us to pick up endoscopic spine surgery.
Correct. I think that was so insightful to hear that real life case that in such a short period the patient could actually return back to their normal work. That's really interesting because earlier this was really not possible, I would say. So now,
Yeah.
Doctor, coming to the same question, my next question would be with increasing demand for minimally invasive and daycare surgeries, where do you see endoscopic spine surgery heading in next say 5 to 10 years, particularly in your region?
Yeah, so in my region, I believe that maybe in the next 3 to 5 to 10 years times, it will be very exciting. We'll move forwards even to daycare or daycare spine surgery, where patient can come in on the same day, done the surgery, and return on the same evening or the next morning. You know, and in some of the selected centers, I think these have been ongoing. These have been done. These have been possible. And technologically, you can see many advancement that's going on, and integration to navigation, integration to robotics, and even AI. It will make
Yes.
yes, AI. Even it will make these procedures even more safer and more reproducible. And I can see that this kind of technology coming in, it will expand endoscopic spine surgery into cervical and thoracic, and applications such as instrumentation will be even more improved and possible. So perhaps more importantly, I think the training will broaden. So more and more surgeons will adopt endoscopy, and patients will have access. More patients will have access. This is one of the reasons
Yeah.
why I have this webinar, so that surgeons will be more alerted. Patients will be more alerted that there are options that is minimal invasive. So in short, the future is here, where endoscopy will no more be like a special option. It will end up as a standard expectation of care, And I believe that as we adopt and more of it, it will be a standard procedure sooner than later.
Correct. I think that's very exciting to hear also. And I think right kind of awareness and accessibility is really such important points that you've mentioned. It's really important. And it actually also highlights how future of spine surgery is moving forward. So Doctor, as we wrap up today's session, thank you so much for sharing your valuable expertise and real world experiences with today on spine surgery. So thank you so much, Doctor.
Yeah. Thank you.
And thank you to our listeners for tuning into this episode. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay informed and stay inspired.